just one more moment before getting started. I see our login is still going up. Thank you for being here. All right, good afternoon, everybody. Welcome to the second webinar in our Increasing School Readiness by Increasing Access to Preschool in Your Community webinar series. My name is Erin Carroll. I'm the Director of our Office of Early Childhood here at the VDOE, and I am joined today by an all-star team, Jenna Conway, our Chief School Readiness Officer, Townsville Jeffries, our Head Start Collaboration Office Director, and Tiffany Mealing, our Early Childhood Specialist, who will all be talking to us today. So to kick us off, I'm going to turn it over to Jenna Conway, who will walk us through what we'll be covering and give us some good framing for the conversation.
Excellent. Good afternoon, everyone. It's great to see everybody. Again, I guess we're here, everybody. We are glad to continue our series. I'm Jenna Conway. I'm our Chief School Readiness Officer. As many of you know, a dual appointment between the Governor's Office and the Virginia Department of Education, really focused on working with you and your colleagues in the field to make sure that all children in Virginia have the opportunity to come to school ready. What we wanted to cover today is to start with the big picture, why we are focused on improving access to high quality preschool this year. And I know we're talking sort of more broadly as we think about both working with Head Start, working with childcare, working with school programming, but kind of give you some up-to-date information on the what we know about our young learners, particularly in response to the pandemic, and what we want you to have top of mind as you start to kick off enrollment activities, which we know many of you are doing. We'll then get into the details. You know that these are webinars that are chock full of details. So talking about the waiver, seat reallocation, pilot on 3-year-olds. What I'm excited about, and what you'll see throughout the presentation today, is we'll highlight how many of you have taken these initiatives, this new funding and new funding flexibility from last year, and put these things into action. And so we'll both celebrate that and also talk about, for those of you who may not have taken advantage of that opportunity, how to do that in the future. We'll talk about the community provider add-on, and then, as we noted, we've got our incredible Director of Head Start Collaboration. We'll talk a little bit about how we can continue to partner. We partner very closely at the state level, and how we can support you to do that at the local level, to make sure that we're kind of maximizing all of the federal, state, and other resources to serve as many of our vulnerable 3- and 4-year-olds as possible to help prepare them for school. And then we'll end with Q&A. Next slide, please. And one more, please. So, you know, here at the Department of Education, we like to start with the why. And we know it is a complicated package of changes and shifts and funding, resources, and flexibility, but it all speaks to or works towards the same goal, which is really making sure that more kids in Virginia, particularly our more vulnerable kids who are furthest from opportunity, have the chance to participate in experience that can really change their lives. I think it's more important now than ever when we really reflect on what we've learned over the course of the last few months of the effect of the pandemic on our young learners, particularly our most vulnerable young learners. And so let me take you through some of the detail that we highlight here. So the first is we're missing a lot of preschoolers. We're missing them from Head Start, we're missing them from VPI, we're missing them from early childhood special education. They're not enrolled, whether you're in person or virtually. And I know all of us have a lot of thoughts on maybe why. And I know a lot of us are also worried about what's going on for these kids. But when we look at, we have under enrollment across the board in our pre-K-12 system, but we see the most significant under enrollment at the preschool and K level. And so we're missing roughly 6,400 preschoolers, and that's a mixture of VPI and early childhood special education. That represents nearly 18% of the system. So the most significant, where we see the most under enrollment when you look at pre-K all the way through grade 12 is in preschool. We also have a lot of kindergartners who are missing, and yet we see there's a pretty stark difference between who's missing in pre-K and who's missing in K. And the kids that are missing in pre-K are often those kids that we're most worried about. We have our children who are Black and Latino children. We have our children who are in economically disadvantaged or low-income families. Those are the places where we're seeing the most significant drops in terms of preschool enrollment. We also know that these are also some of the kids in communities who benefit most from preschool. I think Tondo can talk more about this a little bit later, but we know we're also seeing this in Head Start in terms of pretty significant drops in enrollment this year and participation. We also know that it's been harder when you've been all virtual, and we know that's been a decision that was way above all of our pay grade levels made at the school board level, but we do see some more significant enrollment drops in places where it was a virtual only option. That's our first big takeaway, right? So already we know that there's a lot of disruption in the field. We've got a lot of folks missing from preschool. We know we've got our work cut out of us for us when we think about returning. We also know for those kids that have been able to come and participate that there have been some pretty significant learning setbacks. So I like to think of these as setbacks rather than losses, because I believe in the resilience of kids and particularly of our youngest learners. But we've seen a pretty significant negative impact. We know that more kids started school without the full opportunity to be success. So we sort of seen an uptick in terms of the kids not fully ready based on the Virginia Kindergarten Readiness Program. We saw the single biggest drop in literacy for entering kindergartners, largely based on some of the disruption we imagine over the spring and summer for our vulnerable 4-year-olds. But this is 5 times larger than any other decrease we've seen in the history of PALS. And we know that these decreases or these drops, while experienced across the board, regardless of zip code or race or background, that they were most pronounced in some of our most vulnerable communities. This makes sense when we think of and we sort of hear more and more about the inequitable way in which COVID is affecting our communities, our state, our families, and our kids. But we saw this play out in terms of the literacy data. This could be about literacy, but I should note that I don't think it's just about literacy. I also think some of the social emotional disruption that kids are facing also really precludes them from learning. As we think about kids coming back, we know we have to address the sort of social emotional components of the setbacks or the loss first. What's our strategy on this? We have to kind of double down and really make sure that we're paying attention to our young learners with all of this hard evidence that we see in front of us about the extent of which there's been disruption, there have been setbacks in our youngest learners. Next slide, please. So let's start talking about returning and reopening. We know everybody's in a different place. I'm just going to share the very high level here. We know that people are in very different places right now, and there's a lot of activity, and that's why we especially appreciate you being here today. Some of you, roughly 90 of our school divisions were sort of, as of mid-February, open, some version of in-person available, often prioritized for young learners. We know that the governor called on our school divisions to try to get folks offering some version of in-person by March 15th, and that has resulted in roughly another 40 divisions refining plans and bringing kids back. You may have started this month, you may be starting in March, but we know there's a lot of activity happening, to sort of offer some version of in-person, oftentimes prioritizing early childhood special education or VPI or young learners. We have links here on the guidance, really kind of thinking about, how do you bring folks back? We heard from pediatricians this week. The superintendents heard from pediatricians this week. It is possible to do this safely. And there's new CDC guidance on how to do that, the importance of masking, the importance of some of these mitigation measures. We know it's tough to get little kids to wear masks, but we also know that it can work, right? And we've seen sometimes people say that actually, you know, the pediatricians that spoke to the superintendent's week said actually the 4-year-olds do better than their dads often in terms of actually wearing the mask and keeping the mask over their nose, or something about dads and the dropping of the mask that often happens when they visit the pediatrician's office. And if you want to know either about the guidance or the map, you can go ahead and click on these links here. But I think generally speaking, we expect by mid-March that roughly about nearly all, at least right now, all except for 2 of our school divisions will be offering some version of in-person, and a lot of those will be prioritized for younger learners. And so we know a lot of you are in that flurry of activity. We also know that many of you are still continuing to support in virtual, and so we imagine that will continue throughout the
Sorry, guys, I think we're having a small technical difficulty. We'll wait just a moment for Jenna to dial back in.
All right. Can you all hear me now?
We've got you, Jenna. Thank you.
Okay. Thank you. I do not know. This is literally the only time in which my phone seems to go on the fritz, or that the Zoom disconnects me spontaneously. So thank you for all of the folks who made the comment that you lost my voice. Next slide, please. So one of the things that we've been thinking about a lot as a team, and just wanted to encourage your thinking in this space too, is what we've seen. And as you'll remember, we've been working with folks, and you've been working with folks since last summer. For those people who opened earlier, for those childcare programs who've been open sort of throughout, is that none of us should underestimate what it'll take to kind of get fully back. And I know this happened so suddenly, roughly about a year ago, and it was like a light switch in terms of closing everybody down. It turns out that it's not like a light switch in terms of bringing everybody back. And what we continue to hear for those folks who are offering in person is that it is step by step. It is step by step working with your educators to bring folks back. It is step by step to regain trust with families, to make sure that they feel safe, particularly with our families of color, particularly with our families of more vulnerable kids, like our children with developmental delays, our English language learners. And so we are trying to kind of make sure that we can support you as you think about that family engagement and trust. I think it's going to take more work. We already know it's a ton of work to kind of get folks to understand that high quality preschool is a priority. We know that you do an incredible effort in your enrollment efforts in terms of explaining the why and why it's so important for everybody to have their children in preschool if they're eligible for VPI or early childhood special education. And we think that challenge might be greater now than ever, just because we know families are scared. We know that families are facing stressors. And so really encouraging you as you do this work this spring to recognize that additional outreach might be needed, that will take time to sort of rebuild trust. And that when we think of our goal of making sure that we're getting to our most vulnerable kids and families, that we are going to have to really design our systems to address their needs. And we're hearing this from school systems that are opening across the country, Head Start programs across the country, and really wanting us to focus there. So really be thinking about who is missing when you look back at your data from last year, who's missing, what neighborhoods, what demographics, like why didn't they participate last year, and what might it take to kind of bring those communities, those neighborhoods, those demographics back. Thinking about longer enrollment periods. We're working right now, we'll talk more about this to kind of give you flexibility to enroll for a longer period this year. We want you to get your best guesses by May 15th, but really thinking about, how it's sort of more rolling enrollment. and how you might be sort of even more flexible with all of the flexibility we've given you on VPI eligibility. We know this is true in terms of really thinking about where are the vulnerable groups in your community, where are the folks who have been most sort of impacted and disconnected. And we've included this kind of as part of our Cups and Conversations, so click on your link if you want to hear more. But we really don't want to kind of underestimate what it will take to bring communities back, particularly African American and Latino families, particularly our families of kids with special needs, really our most vulnerable populations. And so really start with your data from last year. Who's missing? What's going on? Where have you seen attendance concerns? For the first time ever, we've seen dramatic attendance concerns in elementary school and in preschool. How do you kind of diagnose what's going on? And then really think about a longer, more intensive enrollment session this spring. Next slide, please. You have all seen this before. We put this back out here just as a reminder for all of us. And I sort of say all this to say, and I can't believe I'm saying this in 2021, but I think we have to kind of be back out there, building the case and talking with our families and our communities about how important preschool is. For whatever reason, as I said before, when you look at the percentage, we saw the single biggest drop in pre-K, 18% of our pre-K program compared statewide compared to the prior year. And I think it's that, and whether it's because of all the stressors our families and communities are facing, whether it's that, you know, we had to prioritize other things, whatever the reason. I don't mean to ascribe blame here, but I think we got to get back out there and be talking and talking and talking till our faces turn blue about why access to quality preschool, why access to quality Head Start matters. I put up this data for both VPI and for mixed delivery. I know Tondo's got similar data for Head Start, but we got to get back out there talking with families. We know that they're afraid, but helping them understand how we can keep their babies safe, and then also reminding them that this is not only right about, oh, it's preschool, it's just 1 year, but it could be such an important year. When you think about how much brain development is happening, when you look at the evidence from Virginia, the difference that VPI, the difference that early childhood special education, the difference that VCF mixed delivery, and the difference that Head Start can make, it truly can serve as a springboard for opportunity for their kids. And so really thinking about that, you know, working your superintendents, working your finance directors, but most importantly, really communicating to your families now and frequently, right, in whatever language and whatever way is most comfortable to them, to remind them why preschool matters, right? We know how much of this brain development happens birth to 5. We know that kids who come to school ready are so much more likely to be successful as they learn to read and then read to learn. And we know that these are investments that pay off for the entirety of their life. And so really helping to remind our families, you know, and our stakeholders locally of that will be so important as we seek to build back. Next slide, please. So in that vein, we're here to support you and make sure that you have the financial resources to do that incredibly difficult work locally. And so you've heard us talk about it, but the governor's budget, and right now, both of the House and Senate budgets that have been put forth and that we're discussing as we speak, restore nearly all of the investments that we have called for in the past year. So funding for more slots for VPI. Right now, we're still finalizing the details, but crossing our fingers for an increased VPI rate. So there's some more dollars, sort of where, you know, putting more dollars in your hands in order to provide quality, to continuing to serve 3-year-olds in the Virginia Preschool Initiative and mixed delivery. We know we really want to be able to provide more vulnerable kids that 2-year experience, very similar to what Head Start does, and sustaining some of those enhancements from last year, the community provider add-on, more investment in mixed delivery, more flexibility for reallocation if you have more 4-year-olds than the formula sort of currently allows for. And this flexibility, we think, will be really important as we continue to respond to the unique needs of your community. We also are continuing to make progress in partnership with you all as we kind of build and unify and strengthen the broader birth to 5 system. And so that's why folks like Tondo are on our team now and working so closely with us. The quality group moved over as of July of this year. We'll move over licensing in the subsidy program. Tomorrow, we kick off the Early Childhood Advisory Committee, which has a VPI teacher, has several Head Start educators, has a school superintendent on it, has somebody who's representative of special education on it. So really sort of a broadly representative group that's shaping our work as we go forward. And then next year, and we'll talk more about this spring, we'll be piloting the uniform measurement and improvement, of which many of you are very well positioned to begin that work. Things like class observations you've already been doing for the last few years, and that's really will be kind of the centerpiece of our work going forward. Next slide, please. So with that, the call to action today, right, very big picture. We know we have a challenge, right? We know that our youngest learners, our preschoolers, our children entering kindergarten, our children in early Head Start and Head Start have suffered greatly, right? And some might even say have suffered most when you look at under enrollment and you look at some of these learning setbacks or losses. We also know we've got to get back out there and work with our communities to help them understand that preschool, we can not only make preschool safe, but to remind them how vitally important high quality preschool is, particularly for our most vulnerable kids and families. And so this is the call to action, is really to begin, if you haven't already, to begin that planning now. We also want you to do that in a coordinated and collaborative way. You've all heard me say before, there's no single provider that can serve all kids birth to 5, and there's really no single provider that can serve all of our 3 and 4-year-olds and really meet the needs of our families and communities. And so this call to action today is to sort of say, how do we build back better? How do we do that in a very collaborative manner? And how do we kind of work with our private partners through mixed delivery and the add-on, with our Head Start partners, as Tondo will talk about later, and with our schools and with our ECSE coordinators, right? Everybody together to sort of run a more coordinated enrollment, right? And to kind of get as many people signed up and let us know about it by May 15th, and really to think about even opportunities like summer sessions and other things as we go forward and support the field and support our youngest learners to recover from all of this loss, the setbacks, and the trauma that we know is going on for them and their families. So with that, let's get in. That's the very big picture. Let's get into a little bit more detail. I'm going to turn it over to Erin.
Great. Thank you, Jenna. All right. So thank you, Jenna, for that framing and reminders of the very important place we find ourselves in, both in our annual typical calendar as we prepare for enrollment, but particularly this year as we consider the incredibly unique and traumatic and troubling experiences that we know families around our state have had this year. So moving to the rest of the webinar, we are really focusing today, and this is a jam-packed amount of content, just a forewarning, but on 5 key strategies that we would identify as critically important as you think about supporting and expanding your enrollment in pre-K. And so we will talk through each of these one at a time. You may hear us going a little bit quickly, but fear not, we will share these slides as well as some written FAQs just as soon as we can. And if we have time, of course, we will get to your questions at the end. So first we will hear Tiffany talk us through the waiver for increased local criteria, which of course can be used to identify and serve more eligible VPI children. We're then going to talk about the reallocation process, the 3-year-old pilot, and the community provider add-on. And then we'll turn it back over to Tandwa to talk a little bit about collaborating with Head Start providers. So again, here we're kind of identifying some of the problems that you might solve with each of the strategies that you are hearing us talk through today. There are many ways that each of these strategies could be used. This is in no means comprehensive, but we want to provide some support in how you might think about plugging in the menu of options that are new flexibilities or returning flexibilities for VPI this year. So with that, and without much further ado, I will turn it over to Tiffany, who will walk us through our first strategy of the day, which is the VPI waiver for local eligibility criteria.
Thanks, Erin. Next slide. We're going to have waivers. So localities, just like last year, localities can apply, identify children. Let's start with the basics. Sorry. They can identify children based on local criteria for up to 15% of your slots. So that's standard before you get a waiver. You can request a waiver to go over that 15% if you if that is needed to meet the needs of your community, what you define as at risk in your community. You must ensure that expanding eligibility will enable the maximizing the federal funds and will not have a negative impact on access for other individuals currently being served. So this past year, 44 localities applied and were approved for the local eligibility criteria waiver, enabling their localities to serve more children. Next slide, please. So the first step in kind of thinking about that waiver would be to identify the needs of your community that go beyond the typical VPI eligibility criteria. So there's not any limit. We don't have any guidelines on what the rationale can be for local eligibility criteria. You should consider the unique needs of your community. Does your community have a particular population whose needs are not being met? Is your community currently filling up that 15% that's standard for your eligibility criteria? Does your locality typically have VPI slots that are not used? So are you not filling that other 85% of the seats with the standard VPI criteria? Are there families who would benefit from VPI based on the needs of their child? So this past year in 2021, there was individual applications just kind of sent it in to us. This year we've actually completed it in the SSWS system, so you'll have to apply via that system. And you're just a few application questions. So select all locally established at-risk criteria locality will use for the upcoming school year. We've provided a list of the most common that we saw this past year, but there will be an other slot where you can fill in something specific to your community. Then we'll ask you to explain the rationale for requesting that increase in the percentage of VPI slots above 15%. And then using the number of VPI slots in your locality, provide an estimate of the percentage that you would like to use local eligibility criteria for. Next slide, please. So here's kind of a timeline right now and for the next month or so, really be thinking about do you need that local eligibility waiver and what needs in your community are not being met? Sometime in late March, we will have the application, the waiver application available within the SSWS portal. You will have to request access to that. People who are familiar with the SSWS system know that you have to have access to the different applications in there. We will certainly send out an announcement when it's available for you to request. And then we're gonna have 3 windows in which you can submit your application for that local waiver. April 1st through May 15th, July 1st through August 15th, and then September 1st through October 15th. And we will review all applications that are submitted during that window at the end of that window. And then you'll get a response from us within 2 or 3 weeks after the window closes. We do submit all waiver requests to Dr. Lane, the Superintendent of Public Instruction, for review. And then our staff also will provide an email response to the coordinator specifically. Next slide, please. So here's just an example of 2 different divisions and kind of how they went about, might go about thinking about their criteria. So Division A has 100 VPI slots based on the General Assembly VPI formula. They enrolled 80 students last year and used local eligibility criteria to fill that 15%. Additional families and children meeting at-risk criteria applied for the program, but were not accepted because that number of students would have exceeded the 15% limit. So this year, Division A plans to fill 100 slots and submits a waiver application in May requesting to fill up to 30% of the 100 slots using local eligibility criteria. So that means that Division A is able to enroll up to 30 of their 100 students or slots for fall 21-22 using local eligibility criteria. Division B has 200 VPI slots. They filled the 200 slots last year, but struggled with recruitment and enrollment based on an approved waiver to fill up to 20% of the slots using local eligibility criteria. Knowing that families and children have been negatively impacted by COVID, Division B submits a waiver application requesting to fill up to 25% using 25% of the 200 slots using local eligibility criteria. So that would mean that Division B is able to enroll up to 50 of the 200 slots for fall using local eligibility criteria. And that's just 2 examples of divisions. There's lots of other scenarios that could work for this. Next slide. I think that is the end of my bit.
Awesome. Thank you, Tiffany, for walking us through that first strategy of using the local eligibility criteria waiver, and for helping us do some math here in the post-lunch hour of the day. So the next strategy we're going to walk through is another that began last year. This is VPI seat reallocation for 4-year-olds. So VPI seat reallocation, this is where localities who typically have wait lists can serve more children than they are originally allocated, with slots that are would otherwise be going unused elsewhere. So this really breaks our VPI divisions into a few different groups here. We know that historically some localities have unused VPI slots, while other localities might have a long wait list. So maybe they are being allocated more than their system is prepared to serve, or for whatever reason, it doesn't quite match up with the number of kids that they are able to serve that year. The way this works now, and it began this year, is localities that report a wait list on May 15th may have additional seats added to their 2021-22 enrollment, and they receive a notice of that by July 1. That also, in turn, means that localities that do not claim all of their VPI seats on May 15th may have been reallocated to other divisions, and we'll walk through an example of this in just a moment to clarify. So localities should consider a few things as they get ready to approach their May 15th application. They should consider that unclaimed VPI slots may be reallocated to another division. So we want to make sure that our May 15th count is an accurate and realistic count of how many classrooms and children you expect to serve in 2021-2022. And keep in mind that slots that are reported as a wait list on the May 15th application may be provided and awarded for that year. So this is another strategy that we tried out this year, and we're very impressed by the success. So this year we had 43 localities have additional seats reallocated to them based on the wait list they reported on their May 15th spring application. This was really pretty huge. That means that 43 localities were able to serve and enroll more children than they would have been otherwise, just by reporting that wait list on the May 15th application. So what's the process for this? So the first step is to receive and understand your allocated VPI seats for next year. So this is available now. I believe it is linked in these slides that will be sent to you. The next step is already underway, so completing enrollment for 21-22. Being aware of how many slots you could serve and will serve. Is it about what you were allocated? Is it way more or way less than you were allocated? And then reporting that when we do our May 15th VPI application. So reporting a wait list if that is applicable, or reporting the maximum number that you will actually be able to use if that is applicable. And then when will you find out how many VPI slots you actually have for next year? The notice of reallocated slots comes by July 1st. So you tell us what you are prepared to do or expecting to do by May 15th. We then can reallocate at the state, and then we will issue a notice of that by July 1, so you know what you're actually working with. So you will notice a theme that the story of 2 localities, so it's not the same 2 localities, but 2 localities will be following us through this webinar today. So just an example here in Division A, So Division A is an example of a locality that receives 1,000 VPI slots, but they know that last year they enrolled 330, and as they're planning for next year, they're looking at their space, they're considering what they're prepared to do. They know that they can at most use 400 slots. So when they report those 400 slots on the May 15th application, that means that the VDOE now has those slots and can use those to reallocate and support other divisions, such as Division B. So looking at Division B receives 200 VPI slots. They had a wait list of 100 VPI students for the past several years. They know that they certainly will again, so they let us know on May 15th that they will have a wait list. And we at the VDOE review the totals and let them know by July 1 that they have had additional slots allocated to them and they can enroll up to 300. So a few additional notes here. So we know that seats that are reallocated in the 2021, 2022, got to get my new years in my mind. The seats that are reallocated for next year will not carry over. So this means that if you have seats reallocated, whether that means your seat allocation is going down or going up, that does not carry over between years. It will not have an impact on what you receive for future years. Seats that are reallocated follow the same requirements for local match, so keep that in mind as you are requesting more. And seats that are reallocated can be used to serve any VPI student. All right, moving right along. Another very useful way to increase the number of children we are serving through VPI, in fact, an entire different age group, is the VPI Pilot for serving 3-year-olds. So this will be our second year of the VPI Pilot for serving 3-year-olds. We started it with this year. This is a pilot process in that it is separate from the 4-year-olds. So localities can serve eligible 3-year-olds, offering an extended early learning experience to more children if they apply. And we are hoping and planning to expand the number of children and localities included in this 3-year-old pilot based on the huge success that we saw this year. So how do we do this? VPI programs must apply to be a part of this pilot by May 15th. This year, that application will be embedded. It will be included as a part of the VPI May 15th typical application. Talk about that more in a moment. The pilot will serve at-risk 3-year-olds who are unserved by Head Start. So the eligibility follows the same guidelines as typical VPI. 3-year-olds can be identified using local eligibility criteria or the typical VPI eligibility criteria. A very important thing to keep in mind, we get questions about this, 3-year-olds are not included in the allocated VPI seats for 2021, 2022. So that means that when you apply or indicate your interest in participating in the 3-year-old pilot, the number of 3-year-olds that you are requesting is above and beyond the number of 4-year-olds that you are allocated through the VPI formula. So again, we were very, very happy to see the success of the VPI 3-year-old pilot, especially in such an unprecedented year. We had a whole of 25 localities apply and be selected to participate in the 3-year-old VPI pilot. In total, that was 822 3-year-olds that were served using VPI funds through the pilot this year. So really making a huge impact in the lives of those young children already just in our first year of the pilot. All right, So a few important reminders about the 3-year-old pilot. So the VPI 3-year-old pilot will follow the same program guidelines and requirements as typical VPI. So that is everything that is outlined in the VPI guidelines for 4-year-olds also applies when you're serving 3-year-olds. The VPI 3-year-old slots may be in a school-based or a community provider setting. And that means that if they are in a community provider setting, which we'll talk about in just a moment, your 3-year-olds would also be eligible for the community provider add-on. 3-year-olds could be served in a single age or mixed age classroom. So you could have 3-year-old classrooms and 4-year-old classrooms, or you could have 3- and 4-year-old classrooms where the children are mixed together. The funding for VPI 3-year-olds also works the same way as VPI funding for 4-year-olds. So it's the same requirements around state share of funds and local match requirements. It's the same amount per locality. And the 3-year-olds are reported to the state through the same mechanisms as 4-year-olds. So that's through the fall student record collection and through the spring student record collection. And the way that localities receive funds is also through the same method as the 4-year-olds through the payment directly to the school division. So the only real difference here is that the 3-year-old pilot must be applied for and that the slots are not included in your initial allocated amount. So what does it mean that they must be applied for? These next few slides are really just giving us a preview as to what the questions are for the 3-year-old application. So as we mentioned, the VPI pilot for 3-year-olds, that application will be as a part of the May 15th application. It will be applied for through the SSWS portal with the typical VPI spring application. We're going to release a superintendent's memo in April announcing the application process and opening the SSWS submission window, just as we typically do. The big change here is that the 3-year-old application will be included in that SSWS application this year, whereas last year for the 25 divisions who applied, they may remember it was a separate paper application. This year we're integrating the process to make it smoother for everybody. So these are some of the requirements. These have not changed over the year, and we'll be sure to reiterate these again as we prepare for this application. There are some specific questions that folks are asked to respond to if they are interested in serving 3-year-olds through VPI. I will not pause because we are short on time to read through all of these, but they will be available in the slides. And then there is some prioritized selection criteria for VPI pilots, keeping in mind that we are working to expand this year, and we really hope, just like last year, to be able to support everybody who's interested in serving 3-year-olds. So some key actions to keep in mind here. We are thinking about this already as we're planning for enrollment and planning for VPI next year. As I mentioned, this will be included in the May 15th SSWS application, so keeping in mind that timeline. And then similar to the seat reallocation, school divisions will be notified on July 1 if they are going to be serving 3-year-olds next year, along with any seat reallocation that takes place. Our example divisions are back. I'll go through this quickly again in the interest of time. But this is just some situations that might inspire a division to think about serving 3-year-olds. There are lots of other reasons, but possibly imagining a situation like Division A, where the division is facing challenges or trying to think more creatively about how to provide inclusive learning settings for 3s with identified disabilities, possibly serving more 3-year-olds those with and without disabilities through the VPI 3-year-old pilot. Division B is talking about a situation where a community has a good setup for community provider settings and offering some VPI 3-year-old pilots in the community provider setting to expand their impact. And that leads me right into the VPI Community Provider Add-on Fund. So digging in here, again, this is a repeat initiative that we will have this year. So this started last year. So this is a way for localities to diversify their program offerings, meeting the needs of more families, supporting providers, and enrolling based on the needs of the community. So the community provider add-on funding encourages the placement of VPI seats in community-based settings. So this means that VPI slots that are offered in a community provider setting receive an additional add-on grant for each VPI slot. The amount of that add-on grant varies depending on where you are and what region you are in. I believe that we have or will very soon share a reminder of which locality, which rate your locality matches with, so stay tuned for that information. VPI slots that are in community provider settings follow the same rules and expectations as slots in traditional school settings, and community providers can be community-based or private provider options within your locality. So we want to really commend some of the divisions who initiated this work this year, especially, again, considering all of the many extra complications and challenges that we had this year. We had 12 localities, more than ever before, report offering VPI slots in community provider settings this year, a total of 619 children. Each one of those children was eligible for additional add-on funds that are now being provided to those localities. So there are a lot of benefits to doing this. We know that it requires some additional work, some additional collaboration, but truly does benefit the community and the families by diversifying the options that are available for everybody. I will not read through all of these considerations, but would strongly encourage you to take a look at them when we send these slides around. So the important things to remember here about offering VPI in a community provider setting: the lead governmental agency, which in most cases is a school division, is still responsible for the oversight of the partnership and lead for state monitoring of the VPI program. That's true for programs that are in community provider settings, just as your programs that are offered in school-based settings. There are lots of ways to coordinate and share resources. We have examples of that. We're always happy to connect folks to talk more about specifically what that looks like. Community providers must still follow health and safety standards by the agency licensing that program, which right now is VDSS. We'll be shifting to VDOE for next year. And then community provider slots still participate in all of the quality expectations for VPI, such as class observations, curriculum, and assessment. All right, many more considerations here. These really get into the specifics of how to think about the extra funds that your locality would receive through the community provider add-ons. Lots of details. The important thing I think to remember here is there are many ways to do this. It looks really different. Of those 12 localities that raised their hand to do this year, I imagine it looks different in every single one. So if you are thinking about this, if you're wondering about the details, definitely take a look at this slide, but also keep in mind other opportunities to ask those specific questions at upcoming office hours or webinars. So, not shockingly, you'll notice a trend here. The planning for this should be very much underway already as we're doing our enrollment. This information should also be reported in the spring VPI application due May 15th. So in your May 15th application, you will have an opportunity to tell us how many community provider slots you're expecting. And then you will again receive notification July 1 confirming those slots so that you know exactly what you're looking at as you head into the next school year. Various ways and reasons why a division might be interested in a community provider add-on. Division A is an example of a division that is limited due to classroom space. And so they have more kids to serve, but they are limited because they don't have space in their building. Division B is talking us through an example where VPI slot may not be in the right locations of their localities. So maybe there are more regional locations where they know might be more convenient or preferable to a family. And so they get a community provider partnership in that space. All right. Okay, so I know that was a ton of information about several VPI specific strategies, and I appreciate the questions that are coming in. But before we do any questions and or record them for our upcoming FAQ, I am excited to turn it over to Tandra Jeffries to talk to us a little bit about working with Head Start.
So good afternoon, everyone. Next slide, Erin. So Jenna did mention, we are all struggling with our current enrollment numbers across programs, and that includes Head Start and Early Head Start. And so we really want to focus on increasing preschool participation and looking at strategies and ways for state pre-K programs to collaborate with their Head Start program partners. So many Virginia localities are already coordinating and collaborating with their Head Start partners to better serve the needs of the families in their communities. A lot of these efforts have been funneled through the PDG communities. So I wanted to give you some strategies that you can look at to increase this level of coordinated efforts in your localities. You could think about coordinated enrollment plans, which will allow for you to maximize the community capacity for early childhood programs, really maximize your funding across federal, state, and local sources. Now, you can partner by utilizing a memorandum of understanding, a memorandum of agreement, or other coordination agreements that will help with a lot of the help from the LEAs, that will help for you to be able to articulate the roles of each program when you think about coordinating together. Joint recruitment is a positive strategy. It allows for programs to share consistent messaging with their families, for families to be aware about eligibility requirements, and then communities can develop some coordinated enrollment practices and registration activities together. One of the coordinated enrollment practices could be one unified application. So by offering this one unified application for families to complete, this will increase their options for serving 3 and 4 year olds and children really birth to 4 when you look at Early Head Start as well. And it does help to eliminate some level of duplication and redundancy in the system, so families will not be required to fill out the same information at various settings. Next slide. So as you're moving forward, here are some questions for you to consider about collaborating with your Head Start partners, thinking about, can you strengthen these partnerships and address the needs by providing quality care for 3 and 4 year olds in your locality? We know that we can't meet the needs of all children, but this is definitely a step in the right direction. Thinking about reduction in wait lists. By opening up the access and serving more 3-year-olds in communities, you are really building a mutually beneficial relationship, and then you're making sure that you're always addressing the needs of the children and families in your community. Thinking about trust and increasing communication across programs, participating in partnerships. That is a way for you to start valuing each program's expertise and creating some level of formalized agreements that will focus on the most comprehensive services for families. Thinking about achieving buy-in and ongoing support from key administrative decision makers in the system. You want to ensure that you have designated leaders for both programs that will work and cultivate and maintain these partnerships. You want to have regularly scheduled partnership meetings so that you're both addressing concerns, look at what's working, what systems you have in place that are moving this partnership along, and what hiccups you might come across that you need to adjust. What considerations could be required to create coordinated enrollment, and how can we make these partnerships thrive? So think about the structure that you want to create. Think about the shared planning that needs to be made and the partnership when it comes to decision making. I've linked down here some information from the Early Childhood Learning and Knowledge Center, and that is the website that, of course, is all things Head Start, and they really talk about coordinated enrollment across early care and education settings. They provide some illustrations from other states and how it's effectively working. We do have most of our early Head Start programs that do coordinate with state pre-K programs, but we do want to expand on that to ensure that we're maximizing the slots in every locality. I also encourage you to register for, as mentioned previously, the Cups and Conversations that's facilitated by Tamala Richardson, who is the Associate Director of Early Childhood Learning. And this is really a way for you to obtain some illustrations from the field that display this level of active collaboration and coordination for all programs. But the goal is to begin these conversations or continue these conversations to expand on this relationship and look at how you can coordinate better. Again, the bottom line is making sure that we're meeting the needs of the children and families in your localities. Next slide. And really quickly, I want to talk about just some examples of localities that are trying to make it work. So again, these stories of the 2 localities. So we do have Division A serving 156 Head Start children and 144 VPI children. And these are some of the ways that they have coordinated together. So they make sure they provide joint messaging for Head Start and VPI program that support recruitment and enrollment. They make sure they have one unified enrollment application for families to complete. They really thought through how can we ensure that all education staff are receiving information in real time. So they coordinate their professional development, their training and technical assistance. They wanted to make sure that all voices will be heard. So they have VPI parents that serve on the Head Start Policy Council, which is the governing board and the decision makers. And they also have Head Start appointees that serve on the VPI steering committee. They make sure that they share all enrollment data between preschool programs, and they participate collaboratively on kindergarten transition activities, which is essential. So it's very inclusive of both Head Start and VPI families. And then we have Division B that serves 90 Head Start children and 174 VPI children. They sat down and thought about how can we work together and establish a selection criteria ranking based on the Head Start program performance standards and also factor in the VPI eligibility criteria. But they too have key Head Start points of contact on their VPI steering committee, and they make sure they have the important key collaborators at the table to coordinate these preschool efforts. Will also, just besides Head Start and VPI, also include early childhood special education, school administrators, health services staff, and community partners. So we know that that building partnerships, they take effective communication and time, but overall these benefits of preschool programs collaborating with their Head Start partners will definitely far outweigh the efforts it takes to establish and sustain them.
All right.
Thanks.
Thank you very much, Tandra, for giving us these great examples. And hopefully at least one of our examples, school divisions, rang true to all of you today. So I know that we are past 2 p.m. So I am not going to do too much more here. The end of these slides have a summary of all of the proposed revisions and strategies for VPI divisions. This will be included in the slides, and these cover some that we talked about today and some that we will talk about at other times. I want to quickly remind folks of the webinars and office hours forthcoming. So this was, of course, our second webinar in this series. There will be the third webinar, the final and third, on March 24th. Not our final webinar ever. There will be many other webinars and opportunities for folks to hear from us, but of this series on March 24th. And then I know we have not gotten a chance to get to questions today. I apologize for that. We just had too much to share, but please do sign up for the Thursday VPI office hours. They are alternating 11 a.m. or 2 p.m. This is the place to go if you have specific questions for your locality, or if you're not really sure where to start and you just want to hear other folks' questions. Sometimes that's really the way to get started and stirring inner ideas, is to kind of understand what are other people thinking about doing right now. So please do look for those and sign up for those. We will.
Sorry to interrupt, Erin. There's office hours tomorrow, and I'll make sure that all the questions that were answered or asked in the chat today get answered tomorrow during those office hours.
Oh, fantastic. Thank you, Tiffany. So if you did not get your question answered today, please try and log on tomorrow. We are also putting together a Q&A document or FAQ document that we will share just as soon as it's ready and update as appropriate. So thank you guys for hanging in. I know this was a ton of information to drop in the middle of your afternoon, but we appreciate your attendance, your great questions, and look forward to talking to you more.